Urine can tell us a lot about our health. Changes in its color, smell, or appearance can signal problems. Foamy urine, for example, can be a sign of something going wrong inside our bodies. While occasional foamy urine is usually harmless, persistent foam can indicate a health issue. Knowing the causes of foamy urine can help us take early action and prevent complications. Foamy urine can be caused by a variety of factors, ranging from mild dehydration to more serious kidney problems. In this essay, we will delve into the different causes of foamy urine, explore when it's crucial to seek medical attention, and discuss the diagnostic tests and treatment options available. We will also provide practical lifestyle changes that can support kidney health and reduce the risk of developing foamy urine. Understanding the significance of foamy urine empowers individuals to take charge of their health. By recognizing the potential causes and seeking timely medical advice, we can address any underlying issues and maintain optimal kidney function. This essay aims to provide readers with the knowledge and tools to make informed decisions about their health and well-being. Remember, listening to our bodies and paying attention to even subtle changes in our urine can be crucial in identifying and managing potential health concerns. Dehydration is a common cause of foamy urine. When we don't drink enough fluids, our bodies lose more water than they take in. This leads to concentrated urine, which can appear foamy. When urine becomes concentrated, the substances dissolved in it, including waste products, become more concentrated as well. This higher concentration can alter the surface tension of the urine, making it more likely to foam when it hits the toilet bowl. Imagine adding a small amount of soap to a glass of water. It foams easily because the soap molecules are concentrated. Similarly, concentrated urine due to dehydration can exhibit increased foaming. The good news is that foamy urine caused by dehydration is usually temporary and easily remedied by increasing fluid intake. Drinking plenty of water throughout the day helps dilute the urine, reducing its concentration and subsequently the foaminess. Therefore, if you notice foamy urine and suspect dehydration, make a conscious effort to drink more water. In most cases, this simple measure is enough to resolve the issue. While dehydration is a common and often benign cause of foamy urine, persistent foam, especially if it's excessive or accompanied by other symptoms, warrants medical attention. One possible cause of persistent foamy urine is proteinuria, a condition characterized by an excess of protein in the urine. Our kidneys act as filters, removing waste products from the blood and retaining essential proteins. When the kidneys are functioning properly, they reabsorb most of the protein back into the bloodstream, leaving only a small amount to be excreted in the urine. However, when the kidneys are damaged or diseased, they may not filter the blood effectively, allowing protein to leak into the urine. This leakage of protein into the urine is what causes the foamy appearance. Proteins have a complex structure that can alter the surface tension of liquids, similar to how soap creates bubbles. In the case of urine, an elevated protein level disrupts its normal surface tension, causing it to foam excessively, especially when it hits the toilet bowl with force. Proteinuria is often a sign of an underlying health problem, such as diabetes, high blood pressure, or kidney disease. Therefore, it's essential to seek medical attention if you notice persistent foamy urine, especially if it's accompanied by other symptoms like swelling in the legs or face, fatigue, or changes in urination frequency. Besides dehydration and proteinuria, several other conditions can cause foamy urine. Urinary tract infections, UTIs, for instance, can lead to foamy urine due to the presence of bacteria and white blood cells in the urinary tract. UTIs occur when bacteria enter the urinary tract, usually through the urethra, and multiply in the bladder. This bacterial overgrowth can irritate the lining of the urinary tract, leading to inflammation and the production of pus. When pus is present in the urine, it can cause the urine to appear cloudy or foamy. Along with foamy urine, UTIs typically present with other symptoms such as pain or burning during urination, increased frequency of urination, and a strong urge to urinate even when the bladder is empty. In addition to UTIs, other less common causes of foamy urine include certain medications, strenuous exercise, retrograde ejaculation in men, and preeclampsia in pregnant women. If you suspect any of these conditions might be contributing to foamy urine, it's important to consult your doctor for proper diagnosis and treatment. Section 5. Seeking medical attention. When to worry. While occasional foamy urine is usually nothing to worry about, persistent or worsening foam especially if accompanied by other symptoms, warrants medical attention. It's essential to consult your doctor if you notice foamy urine that lasts for several days or more, even after increasing your fluid intake. Additionally, seek medical attention immediately if you experience any of the following symptoms along with foamy urine: swelling in the legs, feet, or face, fatigue, loss of appetite, changes in urination frequency such as urinating more or less often than usual, blood in the urine, or pain or burning during urination. These symptoms could indicate a more serious underlying condition that requires prompt medical attention. Individuals with pre-existing conditions such as diabetes, high blood pressure, or a family history of kidney disease should be particularly vigilant about foamy urine and seek medical advice even if they don't experience other symptoms. Early detection and management of these conditions are crucial in preventing kidney damage and maintaining overall health. Remember, it's always better to err on the side of caution and consult your doctor about any health concerns you may have. Section 6. Diagnosing the cause of foamy urine. Diagnosing the underlying cause of foamy urine typically involves a combination of medical history review, physical examination, and laboratory tests. During the medical history review, your doctor will ask about your symptoms, including the duration and frequency of foamy urine, as well as any other symptoms you may be experiencing. They will also inquire about your medical history, including any pre-existing conditions such as diabetes, high blood pressure, or kidney disease. The physical examination may involve checking for swelling in your legs, feet, or face, as well as listening to your heart and lungs. Your doctor may also order laboratory tests to help pinpoint the cause of your foamy urine. Urinalysis is a common test that analyzes a sample of your urine for the presence of protein, blood, glucose, and other substances that may indicate a problem. Depending on the initial findings, your doctor may recommend additional tests, such as a 24-hour urine collection to measure the total amount of protein excreted in your urine over a 24-hour period. In some cases, a kidney biopsy may be necessary to examine a small sample of kidney tissue under a microscope to check for damage or disease. Section 7. Treatment options for foamy urine. Treatment for foamy urine depends entirely on the underlying cause. If dehydration is the culprit, increasing fluid intake is usually sufficient to resolve the issue. However, if an underlying medical condition is identified, treating that condition becomes the primary focus. For instance, if diabetes is the cause of proteinuria and foamy urine, managing blood sugar levels through diet, exercise, and medication becomes crucial. Similarly, if high blood pressure is the underlying cause, controlling blood pressure through lifestyle modifications and medication becomes essential. In some cases, medications may be prescribed specifically to reduce proteinuria. These medications work by lowering blood pressure, reducing inflammation in the kidneys, or blocking the effects of hormones that contribute to protein leakage. Alongside medical treatment, lifestyle changes play a vital role in managing foamy urine and supporting kidney health. Maintaining a healthy weight, quitting smoking, and limiting alcohol intake can significantly benefit kidney function. Additionally, adopting a balanced diet low in sodium, processed foods, and saturated fats can further protect your kidneys from damage. Section 8. Lifestyle changes for healthy kidneys. Beyond addressing the specific cause of foamy urine, adopting a kidney-healthy lifestyle can go a long way in preventing future episodes and maintaining overall kidney health. One of the most important lifestyle changes is to stay well hydrated by drinking plenty of water throughout the day. Water helps flush out waste products from the kidneys, preventing them from building up and causing damage. Another crucial aspect of a kidney-healthy lifestyle is to follow a balanced diet low in sodium, processed foods, and saturated fats. Excess sodium can increase blood pressure, putting extra strain on the kidneys. Processed foods are often high in sodium, unhealthy fats, and artificial ingredients that can harm kidney health. Regular physical activity is also beneficial for kidney health. Exercise helps control blood pressure, reduce inflammation, and improve blood sugar control, all of which contribute to healthy kidney function. Aim for at least 30 minutes of moderate intensity exercise most days of the week. Section 9. Conclusion. Taking control of your kidney health. Foamy urine can be an early warning sign of underlying health issues, particularly kidney problems. While occasional foamy urine is usually harmless, persistent foam, especially when accompanied by other symptoms, should never be ignored. Understanding the different causes of foamy urine, recognizing when to seek medical attention, and adopting a kidney-healthy lifestyle are crucial steps in maintaining optimal kidney health. Remember, our kidneys play a vital role in filtering waste products from our blood and maintaining overall health. By taking proactive steps to care for our kidneys, we can reduce the risk of developing kidney disease and enjoy a healthier life. If you have concerns about foamy urine or any other aspect of your kidney health, don't hesitate to reach out to your healthcare provider for personalized advice and guidance.